More than 3,000 have died in the Ebola outbreak in West Africa and infected thousands more. Many resources are being mobilized to fight the epidemic, including the latest digital technology. CCTV's Francis Coe joins us now to explain more.
Well, no doubt digital technology has played a major role in many aspects of our lives. And now in Africa, healthcare workers and communities are using this tool to help fight Ebola. While experts acknowledge digital technology can't be the only solution, they're finding it's helping them make progress in tracking and preventing the spread of the epidemic.
We've seen Ebola now for about 35 years.
Ebola is not a new disease, but now a more modern approach is being used to fight it.
More capability to do tracking.
Smartphones are part of the strategy, devices rapidly taking off in Africa.
People are also recognizing that there's a tremendous amount of potential to improve their livelihoods.
Dr. Amira Roes, an epidemiologist and professor at George Washington University, has seen that potential firsthand. She's worked in Congo on an Ebola education campaign and has seen how, as the disease evolves, digital technology and the mindsets of those living in Ebola-affected areas are evolving too.
Populations, especially in rural areas, are very receptive to digital technology and to the use of mobile phones, for things that we weren't even anticipating.
And it's many of these rural areas that have been hardest hit by this latest Ebola epidemic. That's where digital technology is lending a hand.
For data collection and surveillance.
An example is Magpie, an application used for collecting, downloading, and analyzing data quickly. Data like the name, age, and location of someone suspected of having Ebola. That data can then be used in mobile labs. This one in Sierra Leone's capital opened only a month ago. The accelerated data relay has helped shorten diagnosis times to hours instead of days.
We can issue the results within 3 to 5 hours. So obviously the diagnostic process is significantly shortened.
And then there's HealthMap, an online tool that scours local news, government, and social media for hints of disease. It identified a, quote, mystery hemorrhagic fever in Guinea before even the World Health Organization announced the Ebola outbreak. Healthcare workers can use it to track the disease spread. It's not just healthcare workers on the ground who are part of the fight. This is OpenStreetMap, which jumps on the concept of crowdsourcing. A couple of million volunteers from all over the world, right from their desktops, have already helped update decades-old maps of Ebola-infected areas.
They need updated maps. They need updated maps to help them plan for logistics. How many cars will they need? How much fuel will they need? Are there hospitals or large buildings or schools that could be used as makeshift clinics?
Digital technology is also being used to disseminate public service videos like this, which can reach remote areas quickly. The idea is to educate local populations about Ebola and dispel misconceptions.
That greatly improved communication, trust between the population and the healthcare workers and the health communicators, and it led to a very good relationship and a very strong response potential for Ebola and other emerging diseases in that area. I think the potential for using these digital technologies is tremendous.